Hi there. Welcome to Animity 1D. My name is Dr. Brian Snyder. I am Dave's endocrinologist.
My name is Dave. I have been living with type 1 diabetes for many years.
My name is Kelsey, and I am a mental health counselor. In this video, we learn what depression is, ways to manage it, and when to reach out for support from a mental health provider. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Thanks for filling out those questionnaires while waiting for your appointment, Dave.
No problem.
There were some questions about mental health that I'd like to check in about during the last few minutes of our appointment today.
Okay. Which ones?
One of the items asked how often have you felt down, depressed, or blue over the last 2 weeks, and you answered nearly every day. Can you tell me a little more about what's been going on lately?
I just haven't been feeling like myself over the past few months. It feels like I'm walking through a never-ending, very dense fog. I can still kind of see the world, but it's so blurry and dull and gray. No matter what I do, the fog won't clear. I feel so stuck.
That sounds really hard to feel like you're in a never-ending fog.
Yeah, and sometimes it feels like this fog gets stuck in my brain too. It's hard to stay focused, and when I do have the energy to think, it's never about anything good.
Thanks for sharing that. How have your energy levels been?
It's so weird because no matter how much I sleep, I never feel rested. And even though I have been sleeping more, I still feel like I have no energy. Even thinking about doing small tasks feels overwhelming.
Based on what you're sharing now, and the questionnaire you completed, it sounds like you may be experiencing some symptoms of depression. Have you connected with a mental health provider recently to discuss this?
No, I haven't. But it might be nice to talk more about it with somebody.
Yes, it can be helpful to talk further about this with a mental health provider. Our clinic's mental health counselor, Kelsey, is a great source of support. Her office is even in this building, and she can be called to come check in with patients during their appointments for anyone who is interested. We work together as a team to provide the best care for our patients. Would you like for Kelsey to stop in for a few minutes today before you leave?
Yes, that would be great.
Okay. Kelsey will be here shortly.
Hi, Dave. I'm so glad to meet you. My name is Kelsey, and I am a mental health counselor here at the clinic. Just like how you meet with Dr. Snyder to discuss concerns related to diabetes, patients can come to me for immediate mental health support or to get connected with mental health resources such as therapy. We all work together to provide the best care for you.
Hi, good to meet you.
Dr. Snyder mentioned that you haven't been feeling like yourself lately, that the world and your brain have both felt pretty foggy.
Yeah, that's right.
What would you say is the worst part of feeling this way?
Probably that I feel physically and emotionally drained all the time. I have no interest in doing the things that I used to really enjoy, like hosting a weekly card game night with my friends.
Depression can feel physically and emotionally draining, which makes it difficult to connect with others.
Yeah, for sure. I've just been keeping to myself lately. But then I get lost in all my negative thoughts.
What are your negative thoughts about?
Just about how bad I'm feeling and wondering what's wrong with me, or if I'll ever feel better. And that I've probably let my friends down since I haven't hosted game night for a few weeks. I don't really want to be around anyone and bring the mood down. Not much sounds fun to me nowadays.
Dave, that sounds really tough. Sometimes when people are feeling depressed, they might have thoughts of hurting themselves or ending their life. Are you having any thoughts like that?
No, I have not.
Thanks for answering. I know it can be difficult to talk about this sometimes, and I appreciate your willingness to do so. These are important questions that I ask all patients who are struggling with their mental health.
I understand.
My last question for today is, how has this feeling of fogginess been affecting your diabetes management?
Well, I haven't really had much of an appetite. Nothing sounds good and I just don't feel hungry like I used to. I've been skipping meals and not really planning to eat on a schedule. Plus, even though I'm sleeping more, I just don't have the energy to get as much physical activity as I should. These things probably lead to some of the roller coaster blood sugars I've had recently.
You have good awareness about how you've been feeling, and having that insight is important. It sounds like you have been struggling with feeling down lately and experiencing some negative impacts on your social life and diabetes management because of it.
Thanks. And yes, it's been tough. What can I do to lift some of this fog and start feeling better?
If you're interested in trying therapy focused on depression, I have some open appointments. My office is in this building, and it's a private space to continue discussing mental health concerns and to find effective treatment approaches to help lift some of this fog so you can start feeling better.
I'd like to try therapy. It's also good to know your office is in this building, since I'm familiar with coming to the clinic for my endocrinology appointments.
Yes, patients find it convenient to have their different appointments in a familiar building.
Let me have our office give Kelsey's clinic a heads up to schedule that appointment.
Thank you, Dr. Snyder.
So Dave, in the first session, we'll spend more time talking about your background, health history, current mental health concerns, and goals for therapy. That information will guide me in finding treatment options for you to choose from.
Sounds good.
Great. Meanwhile, there are some coping strategies that can be useful to try. Depression often makes us withdraw from the usual activities of daily life like exercise, hygiene, social interactions, and things that bring us joy. It may sound counterintuitive, but when you're feeling at your worst, it is recommended to find ways to engage in these activities, even when it feels really hard.
Okay. That does sound counterintuitive, though.
When the feelings of depression arrive, it can make us want to stop engaging in meaningful or important activities, which leads to getting less out of life and amplifies the feelings of depression. This cycle reinforces itself over time. To break that cycle, you're encouraged to do some sort of activity that can promote enjoyment or that is important to you. Some ideas include gentle exercise, calling a friend, or spending time in nature. Is there something you would like to try over this next week?
Well, I have really missed my friends, but I'm just not ready to host game night yet.
You're interested in connecting with your friends, but hosting game night feels too big right now. Is there another way you can connect with your friends that feels doable this week?
I can text with them. There are messages in our group chat I haven't caught up on, so that would be nice to see what everyone's been up to.
Great idea! When activities feel too overwhelming, it's okay to find other ways to do them or break them into smaller steps that feel more approachable.
I like that idea of doing something small, which is better than nothing at all. Sometimes I get so caught up in wondering why I'm feeling this way and wishing it were different that I end up not doing anything at all.
When those thoughts occur, see if you can meet them with some self-compassion. Remind yourself that you are doing the best you can in this difficult moment and be kind to yourself through it all. You are not alone in your experience of depression. Some people find it useful to come up with a self-compassionate phrase that they can recall in moments of difficulties, type on their phone, or hang it on a poster on a wall. Dave, what would your phrase be?
I'm not alone in this.
What an important self-compassionate reminder. There are lots of other coping strategies, and we can definitely talk more about the options and what your preferences are during our therapy sessions.
Thanks. This is a good start.
Depression is a mental health condition that anyone can be affected by. There is no single cause of depression, rather, there are interactions between biological, psychological, and environmental factors that are suggested to contribute to depression. Biological factors may be changes in hormones or neurotransmitters, and genetic components such as a family history of depression. Psychological factors could include pre-existing mental health conditions, high stress levels, or experiences of trauma. Environmental factors can refer to major life changes, like losing a job or a loved one, or experiences associated with having a medical condition. All these factors can interact and contribute to depression. Research has found that people with diabetes are at an increased risk of depression compared to the general population, so it is important to prioritize mental health as part of your diabetes care. As Dave shared, feeling down, depressed, or blue, concentration difficulties, low energy, sleep changes such as sleeping a lot more or difficulty falling or staying asleep, increased feelings of guilt or shame, social withdrawal, decreased interest in enjoyable activities, and changes in eating such as increased or decreased appetite could all be symptoms of depression. Additional symptoms may include feeling worthless, being lethargic or restless, or having thoughts of ending one's life. Importantly, depression can present and feel different for each person. If you are struggling with your mental health, please reach out to your medical team for a referral or find a mental health provider who can work with you to identify what's going on and find the best treatment options for you. If you are experiencing a mental health crisis, such as increasing thoughts of wanting to die, crisis lines such as dialing 988 or texting home to 741 are available as free resources. Thanks for talking with me today, Dave.
It's been helpful to talk to you about this. Before today, I had not told anyone about how I've been feeling so down lately. I think my friends probably noticed though, because I haven't been hosting our weekly game nights.
Glad to hear that talking was helpful.
What times are open for a therapy appointment?
When you check out at the front desk, you can schedule your first therapy session. I'll walk with you to let the staff know to get you scheduled. And I'd like to see you for your next endocrinology appointment in about 3 months.
Great. Thank you both.
You're welcome. And remember, you're not alone in this. Through this playlist, we will learn what mental health is, common mental health challenges that people with diabetes experience, and strategies to support mental well-being. To learn more, check out the resources in the video notes.
Please remember that this is for educational purposes only and is not meant to replace your diabetes or mental health care team. Thank you for watching.